morning, everyone. It's so good to be here. I feel like I'm catching up on 2 years' worth of respite conferences since I had a forced vacation last year. But I did get a lot of painting done, so that was a good thing. So I'm really glad to be here with everyone today. I think the theme of this conference, the musical theme, but also the theme for this particular session, hitting the high notes. The Lifespan Respite Program, as you all know, has been under implementation for now 5 years. We just let our 5th round of grants out, and we thought it would be a really good time to sort of present to everyone kind of what we're beginning to see in terms of results and outcomes. But I also want to spend a little bit of time talking about, at least from where I sit, where I see the program moving in the future and some of the things that we're going to be focusing on. So I also want to spend just a few moments talking a little bit about the Administration for Community Living. I know Sharon Lewis talked a little bit about the structure and how we came to be, but I think the mission and the objectives of ACL really speak to also the mission and objectives of what we're trying to do with the Lifespan Respite Program. So I want to talk about that for just a moment. I won't spend too much time, and then I really want to delve into some of what we've been doing with the program and where we are. So this was sort of this is a statement from Secretary Sebelius, then Secretary Sebelius, at the time that ACL was created, and it really was about creating a better environment for older persons and persons with disabilities and their families to be able to access and utilize services to help them remain in their homes and communities. As you all heard, ACL was formed by bringing together the U.S. Administration on Aging, the Office on Disability, and at the time the Administration for Developmental Disabilities, which when we reorganized was renamed the Administration for Intellectual and Developmental Disabilities. And as a new entity, as a new operating division within the Department of Health and Human Services, ACL is charged with developing policies and improving supports for seniors and persons with disabilities of all ages. So the objectives that were set forth as part of ACL's creation are what really, in another slide or two, I'm going to talk about the objectives of the Lifespan Respite Program. They're a perfect fit. HHS established ACL to reduce fragmentation, to enhance and improve access to services, promote consistency in community living policy, and to complement the community infrastructures as supported by Medicaid and other federal programs. And I think you're going to see a lot of similarities between that broader, the broader objectives of ACL and the more narrow, focused objectives for the Lifespan Respite Program, which is our emphasis on making respite more accessible. I won't delve too much into this. Sharon talked a lot about our mission and our vision, but I think they're pretty straightforward. It's very clear, and I can tell you that all of us at ACL, look at this mission and this vision as a way to guide all of the work we do, all of the new cross collaborations that we're having as a new agency. This is actually really out of date because, as Sharon mentioned yesterday, a couple of months ago, several other programs were moved over under the rubric of ACL. But these are the main program sources, main statutes, authorizing statutes that are administered by the Administration for Community Living. The Older Americans Act, as everyone knows. Public Health Service Act programs, which include the Alzheimer's Disease Supportive Services programs, as well as the Lifespan Respite Program, which I know you all are very familiar with. We also have the healthcare fraud, the Senior Medicare Patrol programs, the DD Act, as well as the Help America Vote Act. And those last couple programs came over with AIDD when ACL was formed. So I mentioned that ACL and Lifespan Respite are a perfect fit, and I believe indeed they are. When you looked at the overall objectives that HHS had for ACL at its creation, it was to address fragmentation. But we look at the objectives of the Lifespan Respite Act, and it's really to address fragmentation of respite. Another objective of ACL is to focus on quality improvement in services. One of the key objectives and one of those things that we focus on so heavily in the Lifespan Respite Program is the improving quality of respite services. HHS envisioned with ACL a cross-program policy focus. And when you look at a lot of the work that the grantees are doing in Lifespan Respite, we see a very, very similar cross-funding stream focus, cross-respite program focus around the services and the policies to really make a more seamless, cohesive respite experience for families and family caregivers. and an improved response to the needs of families, a very broad vision for ACL, a broad objective. But we also see improved response to the respite needs of families as a result of the work that we're doing in the Lifespan Respite Program. Also, ACL works across all age and disability populations, which is exactly what the Lifespan Respite Program does. And family support for ACL is a key objective. And the Lifespan Respite Program, along with our National Family Caregiver Support Program and ADSSP, all work together to really form that base of support for families and family caregivers. So I hope you agree. I think Lifespan Respite is a perfect fit with an ACL. And so what I wanted to do is delve a little bit into the Lifespan Respite Program and kind of where we are. Now, I know that there are many, many seasoned Lifespan Respite folks out there, but there may be some for whom that this is your first respite conference, and if it is, I'm so glad you're here. For those who are old hats at this, then bear with me for a second. But the ACL administers, under the Lifespan Respite Program, we administer competitive grant opportunities to states, and to focus on the mandatory uses of funds that are outlined and specified in the Lifespan Respite Act. And there are around 5 services. It's for the development and enhancement of state and local lifespan respite systems, for the provision of planned and emergency respite for all ages, and that's really the gap filling that many of the grantees are starting to focus on. It's the direction that we've begun moving them as they further develop their programs into the future. A huge training and recruitment of respite providers and volunteers. I'm so pleased with the efforts of so many of the grantees to really focus on ensuring an adequate, well-trained, competent workforce to meet these varied and often complex needs of family members and provide them with really good access. And then I lumped the access piece in so that helping caregivers and families access respite services is that 5th component, that 5th required service. But the entire intent of the Lifespan Respite Act was to get at many of the barriers that caregivers often encountered when they were seeking respite services. The unavailability of workers or an adequately trained workforce, barriers to access, confusing mazes of application processes, information about what respite funding streams and programs may be out there, affordability of respite, and sometimes simply they don't qualify for anything because for whatever reason they may not fit into the eligibility criteria for whatever respite program or funding stream is out there. And so our little Lifespan Respite Program is working to address those barriers. It's working to fill gaps. And I think you'll agree that we've made some really good progress. So Congress authorized the program back in 2006, but we didn't get our first round of funding until 2009. And since then, since 2009, ACL has held competitive grant opportunities every year. And to date, we have funded 32 states in the District of Columbia with at least one initial, what we call our 3-year, they're basic planning grants. Many states use those grants to provide services, but also to look at what do they need to do to better coordinate the various respite programs and funding streams in their states. In 2011 and 2012, we let a number of expansion supplements, which really allowed a number of states, and those expansion supplement grants had a very specific focus: test respite service provision models. Many states wanted to establish new voucher programs or new ways of delivering participant-directed respite. But we also knew that one of the major intents of the Act was to provide gap-filling respite services, and so these expansion supplements allowed us to do that. We have funded a Technical Assistance Resource Center, first in 2009, again in 2012, and I hope you all avail yourselves of the tremendous information and resources that Jill and her team have put together for you. It truly is, a wonderful resource, and I'm constantly amazed at the new information that we're turning out. And we've got some really exciting things coming down the pike that I'm going to tell you about in just a minute. In 2012 and 2013, we started focusing on letting grants to states that enable them to focus on integrating the notion of respite and family supports into other long-term services and support systems change activities, and focusing also on sustainability. As any of you know who work in the public sector, where public funds are used to build programs, sustainability is always, always a huge issue. And so we've tried to infuse the notion of really, really planning for sustainability in your lifespan respite programs. And Jill and her team have provided some very, very sound, solid technical assistance and a very strategic approach to working with the grantees with resources, with guidance and technical assistance on ensuring the sustainability of their projects. And then just this year, in 2014, we funded our most recent round of funding. We funded 16 states for a longer term period, 3 years, three budget years, to really focus long term on sustainability of their lifespan respite programs, but also providing services with hopefully what they have with their newly developed, perhaps their respite voucher programs or other participant-directed services. And we brought on our 33rd new state this year. So I love a picture, and to me a picture really can show sort of the progression of this program, but we're covering well over half the country in terms of states who have taken on this work, who have really focused on the needs of families, the respite needs of families, and better integrating those programs and services into their long-term services and support system. So I kind of like this map. I sometimes go in and I change the colors, if I'm having lunch at my desk. But I'm looking forward to eventually having this entire map covered with different colors representing the different years that we've kept this program growing and moving. One of the things that I have found so striking, and I know that there's a ton of information on this slide, and I hope you can see it, is sort of the evolving focus of the grantee activities. And this is kind of what I wanted to really focus on today, sort of hitting the high point, the high notes. You'll see over all the way to the left that anytime a state gets a brand new grant, all of the 33 states had this focus on very basic infrastructure. Whether it was, getting a better handle on what funding streams and programs are in their state through their environmental scans and needs assessment processes, or going out to families to understand what families and what family caregivers need in terms of support and respite. A lot of focus early on in the program on coalition building, strengthening oftentimes very, very active and very focused respite coalitions, but broadening their base of support and really working with their coalitions to move the respite agenda, the respite programs forward in their states. We saw early on in the program's implementation, 2009, 2010, 2011, with the major round of first grants, a lot of focusing on marketing, public outreach, public information campaigns, the development of respite registries, centralizing all of this information that states gathered in their environmental scans into a centralized place associated oftentimes with the ADRC, which completes that mandate that the states, the grantees work with their coalition and in consult with their ADRCs. A lot of work with volunteer efforts and faith-based programs, some tremendous work in building faith-based interventions for respite. And then new partnerships with higher education. We're seeing that, in Tennessee, we saw the expansion of their partnerships with higher education in Tennessee, but Kansas as well. And caregiver education. I don't believe that you can ever do enough caregiver education about who they are, what they're experiencing, what they may need, how they can better manage their competing responsibilities and stresses. So in the middle phase, we kind of, through our expansion supplements, we saw a focus in the state's grant applications on the development of new service delivery models. So they refined their basic infrastructures, and then they moved into being able to think about, okay, we've always wanted to do a voucher model, or we've always wanted to do some type of service delivery model for respite. And so the expansion supplements in 2011 and 2012, but also the building integration and sustainability grants allowed states to really begin to test service delivery models. We saw a lot of mini grant activities. So the grantee would get their federal grant. They would then in turn move that money out to the local community. And I think that speaks so perfectly to what Sharon Lewis was talking about yesterday, how our support for families needs to come from the grassroots. And so a number of states took the approach of letting mini grants out to test innovative models. Massachusetts, there was a great session yesterday on the work that Massachusetts did in testing respite delivery models. And it was really, really gratifying to see the results. Mixed and varied, but every one of their mini grants had a story to tell and outcomes and results that I think give us an idea for what we may need to look at in respite down the road, and I'll get to that in a minute. With the expansion supplements, but also with some of the integration sustainability grants, I've been able to kind of do a rough calculation based on the numbers I was getting. We've served about 2,000 caregivers with the little bit of lifespan respite funds that we've gotten, and I think that's pretty impressive. You know, a federal program funded at $2.4 million per year. A lot of work on systems change and systems development, but also the focus on service delivery to serve 2,000 family caregivers, I think is pretty impressive, so bravo. The most recent funding announcement for 2014 focused on long-term sustainability and further systems integration. And so when I went through some of the grant applications that came in this year and that were ultimately funded, you can see this ever-increasing complexity of the work that is going on to infuse and to better integrate the notion of respite and family supports into state long-term services and support efforts, systems change, and so on. We're seeing, I'm sure over the next 3 years with these grants, I'm going to be seeing a lot of development of public and private partnerships, reaching out to employers. We put that notion, that suggestion in the funding announcement that the business community, private employers, businesses needed to be brought into the fold. A number of states will begin working with their employers in their states and in communities to infuse the whole, the respite concept and the notion of lifespan respite. We're seeing for the 2014 grants a bit greater focus on rural and minority approaches. Texas has a really exciting intervention that I'll be excited to see unfolding in their new grants that's really working with the Hispanic population and their community health centers, trusted sources of healthcare and treatment for the Hispanic community. How do we then educate those health centers about caregiver support in a message that they will welcome and in a way that they will welcome? We're also looking a lot at improved linkages with critical pathways for family caregivers. So, how do caregivers come to the system? What healthcare systems, hospitals, doctors, a number of the grantees are going to be working to identify those critical pathways for caregivers and then make respite more accessible through some of those critical pathways. And then finally, the measuring systems change, and I'm going to talk a little bit about some of the work that we're doing and what we're going to be talking more at the Grantee Learning Symposium tomorrow about how do we measure systems change. It's one thing to measure impact, but it's another thing to measure systems change and the work that you're doing. So what have we learned so far? And I've had this slide for the past couple of years because very early on, these things began to bubble up to the surface. It definitely takes time. I mean, these are not, the type of work that's involved in developing a lifespan respite program, it can't happen overnight, it can't happen in 6 months, it takes years. It's about partnerships, partnerships, partnerships. I can tell you some of the most successful grants and some of the best work that has come out of these grants has been the partnerships, the new partnerships, the strengthened partnerships, refined roles for the various stakeholders in state lifespan respite programs. Look to model approaches. I can tell you, working with the 33 states, you guys talk to one another. You borrow ideas. You steal ideas. I mean, what was so cool was one state that applied for 2014 actually said, and we're using another state's thing that they did in their early grant. That's just so cool. And so looking to model approaches, and I think moving those model approaches ever closer to, hopefully we can call them best practices, evidence bases, and evidence base. Stay flexible. The grant world is kind of this, it needs to be very fluid and flexible. You all get together, you write a grant, you think, and it's great, and then you actually get on the ground and you start implementing, and well, it doesn't quite work this way, or maybe we should shift gears a little bit. So we've learned to stay flexible. I encourage grantees to build flexibility into their work plans, to how they approach things. The last two are critical, and I'm going to focus for just a moment on that in the little bit of time I have left. Performance measurement from day one. How do we know that what we're doing is working? And that's a tall order when you think of 33 states. All 33 states have different needs in this area, a different base infrastructure in this area. How do you measure performance? And I really think it's going to be a case-by-case, state-by-state basis. And then sustainability as a focus from the beginning. The minute you get your award, it's not too early to plan for sustaining that activity that will end 3 years down the road. So looking ahead, I honestly do see an ever-increasing focus at the federal level on how do we encourage our grantees to focus on sustainability. And it's all about, I think, engaging grassroots and community, building the case for your work at the state and at the community level, looking for those local funding streams for support. Embed these activities into larger long-term services and support systems reform efforts. Enabling the work around respite and family support that you're developing here to be infused into, many of you are looking at the balancing incentive programs or money follows the person initiatives. How do we find a more permanent home for these types of activities? Grow and support state respite coalitions to focus on sustainability. One of the unique things about these projects is that the coalitions who are always involved in every state has a very different role. And I'm beginning to see some state coalitions beginning to focus. Maybe their role will be, how are we going to garner support through advocacy, through fundraising, through applying for other funding streams. Long-term strategic planning, that emerged early on in a number of states. The notion that you take your needs assessment, your caregiver needs assessment, your environmental scans, and you convert them into a statewide strategic plan for family support, for respite, however you want to phrase it. And then using that strategic plan as your roadmap for how you're going to grow the program, sustain the program long term. And also the work that Jill and company have done to support the grantees through their work with the finance project, but also the resources that we have available to the grantees, but to really anyone on the ARCH website for sustaining programs. Being from the federal government, we must measure performance. We do that with our Older Americans Act programs. We do that in any number of ways through state reporting and all of that. We're beginning to look very closely now that we have a few years under our belt with implementing this program, how do we measure the performance in this program? Because what we're seeing is that these grant activities take systems, they look at systems, but they look at consumers. And how do we serve consumers? Those are pretty independent and different things. I think it's easier to measure performance and how you're serving consumers and the outcomes you're having there. And that's certainly the numbers and the information that Congress looks at. But the important work that you're doing to change systems, to make systems more accessible, more navigable for caregivers and for the family members, that's a bit more difficult and a bit less concrete. Because what would be a tremendous change for one state may be a baby step for another. So we're looking, Jill and her team came out with some guidance for the grantees on looking at performance measurement in state lifespan respite programs, really helping states think about what objectives do we want, what outcomes do we want, and then how do we measure and work our way towards determining that we're successful. Eventually, I think in the next couple of years, we're going to see, I'm hopeful that we'll see a new reporting framework when grantees report to ACL every 6 months. It's a pretty basic report. I would like to make that report more reflective and give you an opportunity to show and really demonstrate and catalog the great work and accomplishments that you're doing. And we've been working with grantees very collaboratively on how this is going to happen. And then we're going to be also looking at providing ongoing technical assistance. The final area that I think is critical is building an evidence base for respite. We know there's a lot of research here and there about respite, its efficacy, methods for respite delivery, and so on. But there's really, it's spotty, and some of the results are inconclusive. And so Jill and her team have also been working with a group of national experts, researchers in respite, to understand where we are currently with respite research and to identify some of the gaps and some future directions that we may need to go, which will hopefully give us a tool, ACL, but also you as service providers, as advocates for where do we need to look for additional research and funding. So that'll be coming out early next year, hopefully. So that's all I have. I thank you for your time, and I'm going to turn it over to my next colleague. So, well,
Thank you, Jill, for the opportunity to share some of the highlights. And this will be just the opportunity to cover some very, very brief comments about some of the unique aspects that each of the 3 states wanted to be able to point out that are unique in how we have implemented respite in each of our states. As Jill had indicated, Nebraska has been providing respite through a formal infrastructure since 1999, and we have shared any number of times on national calls and through the various conferences. So I won't go into that detail. So I'm going to just move directly into some areas that I think are more exciting than others. One of which we started last year, and more recently, with the assistance with the notice that we were awarded the 2014 AOA grant, is our employer engagement pilot. And within the last few weeks, and it's literally unfolding by the day, I checked my email earlier this morning and some ongoing communication. I'm engaging in an employer pilot with the University of Nebraska Medical Center, which is one of 4 of our university systems. We have 4 campuses, which involves our University of Nebraska Medical Center, University of Nebraska at Omaha, University of Nebraska at Lincoln, and in Kearney. So what we're going to be doing are a variety of activities that embed respite education through lunch and learn opportunities where we will be providing information about what is respite, caregiving activities, incorporating information for new employee education into the packets, into the whole orientation process. We are going to be sharing information with the wellness resources. Fortunately, we were able to meet with key administrative staff, including human resource personnel and the Employee Assistance Program, the director of our University USED program, all of whom are PhDs in wellness. How lucky is that? So they have real interest in the respite resources and learning more and understanding how we can incorporate families and employees to be able to take advantage of the resources. And equally important is the fact that from the very beginning, the very first component of the conversations, it was complete buy-in, but we are building this as a research model, and this is going to be an effort that has every intention of being replicated elsewhere, both within large businesses, in university settings, college settings, as well as small businesses, academic settings, you name it, that I could spend my entire time talking about this pilot and all the potential opportunities that this is going to afford, but due to the sake of time, I do have to limit my conversation. I'm especially excited in the fact that this, not only because it is a university setting, it is a medical setting, and we are exposing healthcare professionals in a variety of fields that are not only providers of a variety of care, but also we're teaching students who are going out to become professionals so that they are expanding their awareness well beyond what they will be exposed to in the classroom, to what community resources are available to the patients and the clients that they're seeing in their own clinical settings. So, and equally valuable will be the fact that we're going to understand the cost benefit to respite and follow along with employees in terms of absenteeism and with their financial risk that caregiving is costing to their personal life, and building that into their EAP benefit packages. The excitement in the room was just palpable when we had our very initial conversations. So anyway, there will be a lot more to come that you'll all want to follow along with the progress with that particular project. Moving forward, cross-agency respite utilization. Nebraska has historically not been strong in research, and that is something that has just must change, and we're taking very deliberate steps to engaging researchers, and I do have multiple research opportunities that we are now involved with that are university researchers, and we are planning projects that are now moving us forward in not only looking at our network, our lifespan respite network infrastructure, but moving into integrating across all the systems within the state of Nebraska that provide funding for respite, whether it is through federal dollars, state dollars, local dollars, private, volunteer, to whatever expansiveness that we can get collaboration so that we can better understand the breadth of respite, the cost savings, the numbers, the disability or special needs that are being impacted, etc. So this is something that is going to be very exciting for us, and we'll be able to then take advantage of the expertise of university researchers and build that into our current systems and take a look at a very fragmented system of respite service delivery across the state. And in doing that, we have built, and if you're interested in learning more about the technology that Nebraska has taken advantage of, in about 30 minutes you can head next door and you'll be able to learn more about that. We are presenting, and Linda Porter and I from Washington are sharing some space, and we're going to have some fun in a little bit talking about the technology that Nebraska has used. The E-Lifespan Respite System was initially built, again, with the thanks to the Administration on Aging grant, to have a single platform for reporting, for collecting caregiver information, provider information, just a whole variety of data, research, report development, etc. And then in addition, we have a registry for providers that are network approved and the process that goes through. There's quite a lot of information that also ties in with our Aging and Disability Resource Center. But in the last few months and what is now moving forward, we are in the active stages of publicly inviting our partners in, again, these same agencies, whether they are state agencies, nonprofits, whomever, to access certain components of this E-Lifespan system so that they can help us improve upon the reports and the data that we're collecting. And what we're hoping that, and we do have initial buy-in. We've been working with our state unit on aging. We're working with our aged and disabled Medicaid waiver folks, and we're just building upon that. But what we're doing is hoping that we can add to the data so that we have a single source within the state of collecting respite information. And having one location for the expertise and one source where anyone who needs respite information can come to, rather than all these isolated locations. And so from there, have reports that can be drawn down and then disseminated out for whatever purpose the individual agency might have. So that is something that's quite exciting. And something else that we have been teaching our respite coordinators, and those of you who understand, we have 6 regions in the state and under contract. I'm with the state agency, the Nebraska Department of Health and Human Services, and historically, again, there has not been an emphasis or an appreciation for capturing in-kind donations and understanding how knowing the cost of the volunteer time for advisory committees or the cost of having space donated for trainings or a long list, how that impacts what we can understand to be the cost of providing respite or the cost of supporting families to be able to maintain loved ones in the home or support families in any number of ways, and what it truly takes to maintain an agency or to be able to support respite in the community. And so now we have that expectation as a component of sustainability. And for local organizations who are choosing to provide respite in any number of forms or fashions, these are pieces of information that need to be understood. And so it's a teaching opportunity as well. So we're very much involved in doing that as an important component. Now I want to thank my Chicago colleagues, and I know you're all out there. Where are you? There we are with REST, and I know that everyone in the room is familiar and the table out there. But with Lois Kramer and the team, Nebraska has really benefited greatly from this particular caregiver training model. All of our coordinators have been trained in REST, and as has been mentioned, with staff turnover, Nebraska has experienced that. We have, everyone has been trained and then move on to other career opportunities. But you know, for us, that has almost come to benefit us in certain ways because they have taken their training and their experiences with this particular caregiver training model into their new employment opportunities. But what Nebraska is doing with this is continuing to add to the numbers of persons that find value in this particular model. We train our providers as well as caregivers, but what we're currently involved in doing is that I mentioned there are almost an arm's length of partnership opportunities that are being developed through the University of Nebraska Medical Center and through our USED around respite or caregiver issues. And one of those involves the fact that as I was talking about, and literally it just started as a brainstorming session and talking about the importance of rest and such. And I now have multiple department staff who are interested in becoming rest trainers. Clinical staff, we have the rec therapy department director wants to become a rest trainer so that she can train her staff as part of their training component for staff development. And as well as the fact that we will this year then be having 2 master trainers so that we can introduce other organizations across the state of Nebraska to the REST model and be able to do much more than what we currently have time for within the current limitations within the lifespan respite issues. But equally important, the University of Nebraska Medical Center and the University of Nebraska at Omaha both have public health programs that have over 3,000 public health students at both the bachelor's, master's, and PhD levels. So we are in the process of visiting with the student, what do they call them? Their student leadership, but we are introducing and we're going to be working with coordinating rest training for the students themselves and developing it as a credit-based training and introducing this, again, for the same benefit that I mentioned a moment ago, a beautiful opportunity to supplement their academic training so that it's something that is not available to them within their core curriculum. There's not time, but the opportunity to build their resume and introduce them to community-based resources. And the last thing that I want to touch on is the fact that we use the opportunity with our previous grant to explore the need for developing crisis criteria, and then fortunately we're able to infuse it into one of our state-funded programs and have very successfully used crisis respite services for many families, and I'm now engaged in conversations among all the programs that have respite dollars available to their programs so that we can again model what we have found to be very successful in one program and introduce it into others. So those were some highlights. I too will be around and can do some additional information sharing if you would find that helpful. So thank you all very much.
As Jill said, my name is Peggy Spaulding, and I'm with the Colorado State Unit on Aging. We were just awarded one grant, actually, and that was in August of 2011. So we are just finishing up that grant, and I think that we were very fortunate because we were able to meet those goals and objectives that were listed in that grant. And the reason that we were is because of the many partnerships that we had. We had the great knowledge to contract with Easter Seals Colorado. They did all of the hard work, and they made us look really good at the state. And if you guys could just raise your hands, Lynn and Megan, let them know. Yeah, they did a great job. Another one of our partners was the Colorado Respite Coalition. And the coalition actually started prior to the grant. It started in 2008, and we didn't get the grant until 2011. And it was started by two women who knew the need for respite within our community. And both of those co-chairs still to this day are working with the Colorado Respite Coalition, and they make the coalition look good. And one of our co-chairs is here, and that's Val. Would you raise your hand? I'm pointing these people out because they will be able to answer your questions as well today and tomorrow. We also, and the coalition now is up to over 120 members, which is fantastic. The Chronic Care Collaboration was also one of our partners, and they provide advocacy and education and outreach to the 1 in 4 individuals in Colorado with a chronic care need. And they have over 28 organizations with them. And then, of course, the Colorado State Unit on Aging, which is myself. We brought the bureaucratic piece to the group. So this, I don't know if you can see very well, but we also had other partners involved. And those included those that were in need of respite, the consumers, the caregivers, and then on the outer edge, those are the ones that we want to build the partnerships a little more. The higher education, the mental health, the veterans. So we want to continue that partnership growth and make sure that we've included everyone in Colorado. We had a very significant impact thanks to the grant that we received from ACL. We launched our website in 2012, and on that website, you would be able to find some financial assistance. You would be able to find training resources, the opportunities that would allow you to either be trained or to provide that training. We have a respite locator with an online database of over 450 providers. Those providers are allowed to go onto the website to list their services or to update those services as well. And then we make project announcements on there, such as our mini grants when those are available. We will announce those on there. Or if there's a training opportunity available, those will be announced on this website. We also expanded our training in Colorado. We trained over 3,100 individuals in both urban and rural areas, covering the lifespan of ages and the disabilities. There was also a partnership that was developed with Easter Seals, Colorado, and our local university. What they did was they give credits to the individual students for if they do a 10-day in classroom, they get 1 credit hour. If they do 10 days in classroom plus 12 weeks of on-the-job training, then they get 3 credit hours. And this is a fabulous idea because what happens is it not only provides extra trained caregivers in our community, but it allows those students to earn some extra money as well. Now, as you know, as a state employee, I am not allowed to lobby. But as our presenter yesterday, Representative Bo Mitchell, stated, you need to get in front of your legislators. You need to let them know there is a need. If you don't do that, they don't know. They don't realize that respite is a need. So Easter Seals and our Colorado Respite Coalition got in front of our legislators. And in 2012, they passed a surcharge that is placed on individuals who commit a crime against at-risk adults or at-risk juveniles. So that was great. The law was passed, it's in effect, but the problem is that since it passed, there has been a little over 120,000 assessed onto these individuals that have committed the crimes, but only $9,000 has been collected. The reason is because those individuals need to make restitution to other entities, such as their victims, before they can pay this surcharge. So in 2013, they went back to our legislators and said, can we get a higher surcharge? Can we put a surcharge on something else? And our legislators were very standoffish. They said, no, we don't want to do that to the Coloradans. We don't want to add more surcharges. We don't want to do more of that. But we will give you $150,000. So we got $150,000, which had to follow the same regulations as the law that was passed for the surcharge, meaning those funds had to go to a nonprofit or government agency providing respite services or to provide education on respite. And then this year, we went back to the legislatures, and they gave us an additional $100,000. So now this year, we are working with $250,000, which we are very grateful for. And I know what the question is that's running through your minds. I'm from Colorado. We have legalized marijuana. You know that we have big taxes on that legalized marijuana. Did that money come from there? And it did not. But that doesn't mean that we're not going to stop. We're going to try to get that money from the legalized marijuana. So go ahead and come on out to Colorado. So basically, some of the things that happened with those grant funds, with the surcharges, and with those state general funds is we were able to reduce service gaps because we gave out 28 grants. They were from $1,000 to $27,000. And what had to happen was we put out on that website and we sent everybody that we knew an email that said, we are going to be doing these grants, and did a request for proposal. We got several proposals in. We had a committee that went through those proposals, and then the grants were awarded. So 28 grants statewide were awarded to cover the lifespan, all ages, and all ranges of disability. Now, I really have to say that I was very grateful at this time that we contracted with Easter Seals because I didn't have to monitor those 28 grants. Instead, Megan had to monitor those 28 grants, and she never once got mad at me when I call her up and say, now, Where are you in this spending? You know, have you talked to them? Have they done what they said they were going to do in the proposal? Where are we? And they had to do surveys at the end of that with the consumer that received those grants, so we were able to get evaluations on those as well. So that was really a great impact. Other things that we've done is outreach and education. You can't do a surcharge without educating the district attorneys to let them know it's there. Go ahead and add it as a surcharge. Even though we may not be able to collect it right away, we might eventually be able to get that money, and the judges. We also went out and did education with the area agencies on aging, our Aging and Disability Resource Centers, which are both programs that I oversee, and our providers and our caregivers. If you look at this map there, this is a map of Colorado. And as you can see, each of those dots represents something that has occurred in that area with the respite grant. Whether it's a training that occurred, whether or not it's a grant that was received, or whether or not the district attorneys were trained, or there was information disseminated, such as a training that we did with the Aging and Disability Resource Centers, or the area agencies on aging, or the website hits. But as you can see, there was a lot of information that was provided. One of those dots also represents a summit location. I'd like to talk a little bit about that. In 2013, we hosted 3 summits. We invited all the stakeholders in the various areas, including legislators, and everyone got together, and what everyone realized is there was a need for respite. And that one summit wasn't going to resolve that need. And so what they did was they decided that they were going to develop their own coalitions. So we ended up with a Northern Colorado coalition, a Southern Colorado coalition, and a Western Slope Colorado coalition. Those still work within our main Colorado Respite Coalition, and we all work together and we collaborate. So we did receive the 2014 grant award in September, and we have a lot of high hopes again, because I think we accomplished a lot in the last 3 years, and we're hoping to accomplish even more with this 2014 grant. That university training that we talked about, the partnership, we're hoping to be able to develop a toolkit so that that will be able to be shared with other universities in other states. We're also hoping to do something similar to what Nebraska is doing, and that's develop and implement an employer engagement training. This one I really feel is very close to my heart. I also oversee the caregiver program with the Title III E-dollars with the AAA. And when we first got those funds, we had gone out and tried to begin an employer training, and they weren't real receptive. So I'm really going to be curious to see how this training actually unfolds and what some of the challenges may be for this. But I'm very excited about doing it. We're also doing some new trainings coming up for AIR, which brings together the families and in one location. And then it allows the caregivers to go on their own track, which there's education, there's resources that are provided, there's respite provided, and then the care recipients go on their track of activities. They're able to do things that are fun for them as well. And bringing down barriers, which provides training for our educators, for our professionals, to train on disability awareness, to train on how to integrate individuals with disabilities into the regular activities. And then one of the things that we would like to do is to develop and implement a voucher program for emergency respite. As you know, a lot of times, it's not something that's planned that you need respite. It's, I need it and I need it now. And so what we would like to do is to develop that and in a voucher format. And then of course we want to increase our social media with Twitter and Facebook. I guess I'm gonna have to learn those. I don't do those. But again, that's Megan. It's great when you're the contractor, you know. And then also to develop those partnerships that I spoke about earlier, the partnerships with the veterans, with the mental health, We really need to get more collaborative with those and working with the respite programs in Colorado. And we're just really very excited about this 2014 grant, and I thank you for your time. And again, I will be here as well for questions, and I pointed them out very well, right? You guys all had them. They'll be here as well to answer any kind of questions. Thank you.
Good afternoon. My name is Tabitha Satterfield. I am the Aging Program Coordinator at the Tennessee Commission on Aging and Disability, also the Project Director for the Lifespan Respite Grant. So Tennessee actually received one of the Lifespan grants in 2009. It was a 3-year grant, and we also received the expansion grant in 2011. Our key partners is the Tennessee Respite Coalition, which Jennifer Abernathy is the executive director, and our regional respite collaboration groups. There are 7 of those across the state. Our area agencies on aging and disability, which act as our ADRCs in Tennessee, and the Department of Mental Health and Developmental Disabilities. So Tennessee already had an existing lifespan respite care system in place, and that included the statewide toll-free helpline, which is through the Tennessee Respite Coalition, where families can call in and find out information about respite that's available within our state and how they can access those respite services. They also have a family-directed voucher program, which I'll talk about a little as we move forward. And the 7 regional respite collaboration groups, they are actually made up of our respite providers, caregivers, the Developmental Disability Council, and the Department of Mental Health, as well as other agencies that have an interest in respite care. We had an established system of our 9 area agencies on aging and disability. There are 9 of them, and they act as our single point of entry for adults, our elders, and persons with physical disabilities. And there is some funding for respite services through various agencies as well. With that system, there were some barriers. The system was fragmented. Access of caregivers to respite was through categorical funding, depending on the disability, the disease, the diagnosis, age. And so that system needed to be where we could have cross-referrals and sort of connect all of those and coordinate those systems. We also had no formal system statewide for information and assistance about respite services across the state. So that was something we wanted to be able to do as a part of the grant. Our goal was to expand, enhance, and formalize a system that would improve statewide dissemination, coordination of respite, and provide and improve access and quality of our respite, which would reduce caregiver strain. Our main objectives were to facilitate coordination among our respite programs and providers and ensure an inclusive coalition of respite services, to increase access to respite through a no-wrong-door coordinated system, and to enhance the abilities of the Tennessee Respite Coalition to respond to the respite needs of our families. And we also wanted to increase volunteer respite statewide. So today I thought we'd focus on 2 of those areas, which is the family-directed voucher program and volunteer respite. As I said before, the TRC already had a model in place for family-directed vouchers. That has been in place since 2004, but it was not applicable across all ages and disabilities. I mean, they had funding from different grants, but it was sort of limited to what the disability or the age, and so we wanted to be able to offer something that would cover all ages. And we also wanted to expand the grant statewide, and so the family-directed program, it means that families who are selected will be able to provide their families with respite, and they have the opportunity to hire their own family members, they can hire friends, or they can choose an agency. As most of you know, respite for families needs to be flexible and allowing for families to have choice in who they bring into their homes. It could be ongoing or a one-time need. And it was flexible for families as it relates to service delivery. They could have someone come in during the evening times. They could select how many hours they work, who they would bring into the home, how much that person would be paid as well. So caregivers could enter into that program through 3 different ways, either through the statewide respite helpline, which I think at the beginning of our grant was about 700 calls, but at the end of the grant has expanded to, we had over 2,000 calls that came in through that respite statewide helpline. Referrals came in from our area agencies on aging and disability, who had the National Family Caregiver Support Programs, but as you know, those dollars are limited, you have wait lists, and so they can make referrals as well. And referrals came from our regional respite collaboration groups. Families would get were awarded a $600 bank that could be used for respite of their choice. And because they had the ability to use non-agency respite, the cost is less. And it would allow families greater flexibility and additional respite hours. So in the grant, 282 caregivers received 26,459 hours of respite. And that respite is valued at over $542,000, but actually at a cost of $101,000, a little over $101,000. So the next piece is our volunteer respite. The Chattanooga Volunteer Respite Program partnered with the University of Tennessee at Chattanooga, their psychology department, to provide field practicum hours for their students. And this was coordinated by the Respite Training Coordinator, which is at the TRC, but located there in Chattanooga. And students would complete a brief practicum, but they were required to do 100 hours of volunteer work in a semester, and they received 3 hours of class credit. Volunteer work was done through respite agencies or through affiliates of the TRC. They were able to expand this to the Chattanooga State Behavioral Science Department, and it was sort of different in that there are no set number of volunteer hours, but students could earn extra class credit. And so with that effort, the Volunteer Respite Program provided respite to 561 families, receiving 17,315 hours of respite. So as all of you know, sustainability is very difficult as it relates to our lifespan respite grants. But we're committed to providing respite to our families and continuing the volunteer efforts. The TRC was awarded sponsorship for a senior companion program in Davidson County, which allowed them to train and manage volunteers over the age of 55 to be respite volunteers. They also received additional grants, which provided funding for respite. And there, as Jennifer's and her crew are very, they've got great ideas at looking at unique ways for fundraising opportunities. And some of those included the Jazzin' for Respite, Art of Time, and they also do an annual campaign. Other activities that we were able to sustain through the grant are the regional respite collaboration groups, there are 7 across the state. They continue to meet, some on a monthly basis, some quarterly, but they do continue to meet and look at resources and what is available within our state and how we can better serve our families. We continue with the respite helpline through the TRC. Through the awareness that was done throughout the grant, there are cross referrals for caregivers among collaborative agencies. And we have a respite resource database. And that database has grown tremendously and is shared, which is used for families as they call into the helpline. They can find out information about respite services across the state, caregiver support groups, training events, and different things that are held for families. And we also have introduced that piece to our area agencies, and it's a part of their ADRC resource database. So moving forward with respite in Tennessee, we're very excited. We were awarded the 2014 Lifespan Respite Care Grant. And our goal is to expand and enhance existing respite resources, opportunities for respite services, and invest in strategies to sustain respite for our family caregivers. We're looking at expanding our respite service delivery, continuing with our model of the family-directed voucher program, and looking at increasing availability of our trained volunteers using the REST model. As we've heard, a number of different partners are using that model as well. We're also looking at marketing our efforts to caregivers, to making them aware of what we have. We've developed the respite resource database, but we want to make sure that our families across Tennessee are aware of what we have to offer our families. And the last thing is to develop a statewide respite caregiver support strategic plan, which will bridge the gap between respite and family caregiver support services across the state. Thank you.